I'm Dr. Rebecca Lewis, and this is a PNI Minute. A common myth that people perceive about cochlear implants is that you have to be deaf or have profound bilateral hearing loss to be a cochlear implant candidate, when actually cochlear implant candidacy has expanded greatly over the last 5 to 10 years to include single-sided deafness or unilateral hearing loss, asymmetric hearing loss, or even normal low frequencies and becoming a hybrid candidate. Patients are even wearing a hearing aid in one ear and a cochlear implant in the other, which is called bimodal stimulation. And we know that having a hearing aid on the opposite ear of a cochlear implant, that acoustic hearing actually can make the implant sound even better in terms of music perception and speech understanding. Another common cochlear implant myth is that you can't actively participate in hobbies and activities that you used to. The cochlear implant manufacturers have worked on waterproof accessories. Patients can enjoy the beach, the pool. Even if their child has a cochlear implant, they can wear it in the bath and not miss out on that time talking to their kiddo. They also now have wireless accessories so that you can hear better in a restaurant. You can have your spouse wear a remote microphone that streams directly into your cochlear implants. Recipients can enjoy streaming podcasts and music just like people do with their AirPods. And then going running or playing sports like soccer, any of those sorts of things, the cochlear implant companies now have retention devices to help you keep your implant on while doing any kind of activity you like to do. Another myth about cochlear implants is that you're either too old or too young to receive a cochlear implant. A growing demographic is the 80-plus group, and research shows that actually these patients do very well with cochlear implants, similar to younger adults. And as far as younger children go, the FDA has approved cochlear implants for 9 months old and older, and some families will actually choose to request an off-label authorization of cochlear implants so that their children can be implanted younger, which is routinely done in other countries, because we know earlier implantation is associated with better speech and language development compared to their normal hearing peers. One other myth about cochlear implants that scares people is that they think it's brain surgery. The cochlear implant surgery is not near the brain. Our very skilled surgeon makes an incision behind the ear and drills into the mastoid bone to thread the electrode array very carefully into the cochlea, and the receiver stimulator is tucked underneath the skin above the skull, sort of right above the ear, and it's a 2-hour at tops outpatient procedure. You go home the same day that you come in for your procedure, and usually you're feeling good within the day or two, just the effects of anesthesia. Another myth about cochlear implants is that it will restore your hearing to normal. With a cochlear implant, you will detect sounds maybe in the normal hearing range across the frequency array or across the speech spectrum, but the ability to understand speech and noise may still be a challenge. You may still occasionally need to see somebody's face to communicate with them in these types of environments. The good news is that these cochlear implant companies have done a lot of research, and they realize that these remote microphone technologies are really important for cochlear implant recipients to hear better in background noise. Generally, patients always do better than they did with hearing aids with a cochlear implant. So it may not be 100% normal, but there's a significant improvement in speech and language, quality of life, localizing sound, hearing at a distance, and even sometimes in background noise.